So the question is, I'm post-surgery or post-injury and I'm training, how much pain is okay? How do I manage or think about that? So let's set this up for a second. First of all, let's appreciate that if I'm subacute and really trying to protect some tissues, I'm probably being followed by a provider. But let's keep in mind that no one is seeing their provider 3 to 5 times a week. That's an impossibility. No one, or unless your provider's in the gym following you and you're a pro athlete, there's always a type 1 error there. So our athletes have to have some guidelines about when they train with an injury or train post-surgery. How do I know if I'm doing injury or damage? Is the pain signal mean that I'm traumatizing something? So first and foremost, appreciating that, look, there is some art and science to getting enough exposure to a tissue so it can continue to adapt. And it's not always just about strength. It's just about loading the tissues. And there are some basic guidelines on that which we always preach about. Well, isometrics and breathing, tempo, moving slowly, right? Basic linear progressions, constant exposure, all of those general rules apply. But sometimes we're still gonna have some pain in the tissue. And the way to think about that is that you've got a surgery or a trauma, and now your brain is super clever and has learned that there's something going on with this tissue and it needs to get your attention. So let's first of all appreciate, especially post-surgery, that pain in a tissue does not necessarily mean that you're doing tissue damage. Let's be very clear about that. Let me say that again. If you're having pain post-surgery in a tissue, it does not necessarily mean that you're doing further damage. Remember, those tissues have become sensitized and your brain is very, very clever around that. So instead, what we end up thinking is, hey, part of getting someone out of a painful tendon problem, for example, or for me, my kneecap is a little sore in some of the positions I'm in. Here I am 6 weeks post-surgery of a total knee replacement, is that I've got to load the tissues appropriately, and I want to keep in mind that my brain is still trying to protect me, right? So pain is going to happen with those some specific positions. So what first thing is we can say is, hey, it's okay. It's a little bit of pain and movement, that's okay. So start there for starters. Second is to say, hey, look, if I see a delta or a change in my symptoms while I'm loading, that may be a cue that I've had enough load. So for example, I have no problem squatting, right? I'm working on my squats, but loading this long anterior line, smoking the quads in hip extension, which is another position I have to be competent in, I start to get some discomfort around my knee. So what I'll see is that I will train in that position and shape, and I'll be comfortable with that because I can get out of position and it stops. That's a good sign. Or while I'm training, all of a sudden I see a symptom where, hey, it's gone from kind of a 2 or 3, it's kind of nagging, and poop, it's kicked up to a 5. So pay attention to the delta. This is a great general rule for your athletes when they're loading tissues again and again. I'm not jumping and doing dynamic loading, I'm not Olympic lifting, I'm just starting to expose the tissues. This may even be as simple as pedaling on a bike, right? That it's okay, I've got to load that. Again, if we have a painful tendon in running, tendonitis, no tendon ever got better with absolute rest. So it's really this dose and response, which brings us to the second piece, some latency. So traditionally, if you went and saw a rehab specialist or a training specialist after surgery or seeing someone, what they would say is, how'd you feel after our training session? The problem is traditional rehab settings now, or post-injury surgical care settings, there's too much gap between the stimulus and the next time they see you. That's just the way managed care is. So as this shifts back on, I always tell athletes, let me know how you felt the next day. So one of the cues is, hey, I have a little pain when I move. That's fine. My pain started to change, or my feelings about it, or my brain started to sensitize that a little more, pay attention to that during the training session. Probably cut off my volume there, right? I'll push that tolerance up as I get a little further. But the next day, increased soreness may tell me about, hey, that was a little too much volume, right? And so what we do want to know is pay attention to the fact that, hey, as I'm treating these tissues, it's no different than thinking about sort of being into some immense pain under doing some heavy loading if I was not injured. I'd want to know, hey, have I changed my symptoms? Has I changed my power, my wattage? Those kinds of things are cues that I've lost this. changes in my subjective experience of what's happening can tell me what's going on. And then afterwards, managing that load sort of appropriately so that I'm not too sore the next day or haven't overdone it. The goal is to be able to challenge the tissues so that the tissues have an appropriate stimulus, and then my goal is to try to manage that stimulus for adaptation. So in short, if you are post-surgery, post-injury, and you're starting to train again, you can always follow the basic rules. Slow down, right? Make sure that you own your isometrics. Make sure you can breathe in that position. Progressive overloading, basic linear progressions, comma, when you see a definitive change in your pain experience, that's a good time to know that you're overdoing it. Make sense?